Hi, everyone. My name is Jacob Fortung. I'm the host of Doers Within Us podcast, and I'm honored and privileged to have with me here a builders of Africa's Future, a collaboration that we have with the Africa Diaspora Network, Sister Jane, Frances Kabagaaju, and she, as all the other three builders of Africa's Future that I've had on the podcast. These are amazing entrepreneurs on the African continent making a difference in their respective fields. So the last name actually, Sister Jane Frances' last name is Kabagaaju, I think. Kabagaaju. And she is in charge of the clinic. She's an in-charge clinical officer of the Nkuruba Health Centre based in Uganda. And I'm just honored to have her here for her to share her story. And please, we'll give you the floor just to talk a little bit about, yourself, so that we can get to know a little bit more about you. So please, Sister Frances, the floor is yours. Can you just share with us a little bit about yourself, where you grew up, and what it was like growing up in Uganda, for a start?
Okay, hello everybody. Hello, Jacob. I'm Sister Jane Frances Kabagaaju. I'm the third born and firstborn girl in our family. I follow three boys. I can say I have some characteristics of men. I was climbing trees, playing football. So visitors could come and ask, is this child a boy or a girl? Innocently, I could say, I could show them that I'm a girl. Don't ask me how. My mother told me a story that after giving birth of three boys consecutively, had a very strong desire to have a baby girl. Oh, there comes a baby girl, a woman. Everyone in the family was happy about my birth. They gave me a variety of names, but my parents retained Jane Frances Kabagaaju. One thing I remember when I had grown up is that my father loved and trusted me so much, to an extent of giving me a responsibility of buying books, pens, and paying school fees for my elder brothers and my young sister and one boy at school. I was clever in class. My father liked me for that. Unfortunately, my father died when I was doing my mock of senior 4. It was a blow to me.
But
I thank my mother, Amoti, who is still alive, and my aunties and people of goodwill who labored and toiled to educate my brothers and sisters. Glory be to God, and God bless them. I lost to lose a mother. I'm sorry to say this. At an early age, you may rather lose a father. Families are breaking when a mother in a family dies. Sorry to say this, but women play a big role in a family. So where I grew up in a village called Nyabusenyi in Kirere Parish, Busoro Sub-County, Burasha County in Fort Portal City these days in Western Uganda. I grew up in a religious family where my father and mother were committed Catholics. They instructed me in Catholic faith and helped me to grow in my religious vocation. I belong to a clan of Wanekera, which love and support each other. At 7 years, I joined primary school at Mpumbu Primary School. We used to walk from home to school. After primary 7, I joined secondary school at Kitumba Senior Secondary School. The distance was long, so my father took me to my auntie who was near that school. After senior 4, I joined the congregation of the Daughters of St. Teresa of the Child Jesus, locally known as Vanya Teresa Sisters, where I have served for 32 years. I was inspired to become a religious when I was in primary 3 by missionary medical sisters who had come to immunize us against an outbreak at that time. God's ways are not ours. I became a religious and a medic personnel like them, but in a different congregation. After becoming a religious, I was trained as a nurse, and later on, I went for clinical medicine and community health course and qualified as a clinical officer. After 10 years working as a clinical officer in the rural health center, I was asked to do a course of health service management at Nkuruba University. After that course, I was asked to coordinate health services in Hoima Diocese in 4 districts, that is Hoima, Masindi, Kivale, and Kiliandongo for 2 years. From there, I was appointed as public health care coordinator in Vilika Hospital for 2 years, again going to the rural communities. At the moment, I'm the in charge and the clinical officer of Nkuruba Health Centre, where I have served for 8 years. Now I'm counting 22 years, serving in rural and hard to reach communities, soon celebrating Silver Jubilee. I also served as a chairperson of sisters in the medical field in our congregation. What is it that, what is it like growing up?
Yes.
Through what I have gone through and what responsibility I have been given and the challenges I have gone through, plus the opportunities which comes my way, I feel God is calling me to be an advocate for the less privileged individuals, communities, and the nation at large. Who were my mentors in my life? At home, my father and mother mentored me in good morals and leadership. As I told you, my father used to give me money to go and pay school fees, buy books for even my elder brothers. Then even my elder brothers, as men, as boys, they mentored me to be a strong woman like a man, because they could follow what they were doing. And I became a very strong woman. I'm a strong woman because of my brothers. My teachers at all levels mentored me to be serious with studies and to be a responsible citizen. In the congregation, my first mentor was Sister Leonia, my aunt, who would always say, be practical. Be practical, Sister Jane, be practical. Other sisters who mentored me were the formators in the novitiate and Senap. I can't forget Sister Grace, who always say, what I want is quality, not quantity. And always that stick in my head and say, quality, not quantity. The Mother General of our congregation, who gave me responsibilities which could help me to be more responsible in leadership, which helped me to meet challenges and find solutions, also mentored me in those appointments. How our organization, that is all about. Yes. my background.
That's amazing. That's amazing. And I think you're the people that God gave you are really gave you that platform to really become what you are today. And thank you so much for sharing that. And to all your brothers and your mom, we appreciate you for giving us you, and just someone like you to be a force of nature in Uganda. So thanks for explaining that, because I think the foundation of where someone came from and how someone became who they are is very important in the work they do. So I think it would be great for us to learn about the clinic, the health center you have, and as a clinical officer at the Nkuruba Health Centre, if you can share with us, you know, how it started, and
Yes.
And I will appreciate that. So please, the floor is yours.
Yeah. So Nkuruba Health Centre started in 1974 by the Congregation of the Daughters of St. Therese of the Child Jesus, locally known as the Teresa Sisters. The health center started in a very humble way. It started from the convent's veranda. Many patients started coming. This created a demand to construct a 3-room building to offer only outpatient services. There was still more demand for other services like inpatient, maternity child health services, like antenatal, deliveries, postnatal, immunization. Again, the number of inpatient and deliveries increased drastically. Then, by the help of donors, well-wishers, and the community itself, raised funds and constructed 3 wards: children ward, female, and male. Then, an organization, the Monas Union, that's when we presented that we don't have a separate maternity where you can attend our mothers from. They also gave us money to construct maternity. So maternity is in place. The old OPD which we had and which could not accommodate the HIV clinic and other patients. So after constructing the new outpatient, the old one, we used it for HIV clinic. And this facility is offering many services. We have outpatient service, we have inpatient, we have immunization, we do antenatal, we deliver, we do postnatal. We also do HIV/AIDS care and treatment, counseling, EMTCT, that is elimination of mother-to-child transmission, then early infant diagnosis. As a faith-based facility, we do natural family planning. Then we do a health education, laboratory services. Then we have staff. We have a number of staff. We have clinical officer, we have 1. Enrolled midwife, we have 3. Enrolled nurse, we have 1. Enrolled comprehensive nurse, we have 1. Medical records assistant, we have 1. We have 2 askaris. The lab assistant, we have 1. We have an accountant. We have a cashier. Then the nursing assistants, we have 2. Then we have RCT volunteers, random counseling and testing. Then the place was in the rural and hard to reach, and vulnerable groups were suffering, like pregnant mothers and children. This gave us an opportunity to contribute to goal 3 of the Sustainable Development Goal. And I was privileged last year, 2021 in October, Sister Celestine, through our Mother General, Mother Mary Goret Kabakaaju, asked for a sister to take a course in entrepreneurship. By good luck, the chance landed on me. I went through this course, and finally, I was selected to join Builders of African Future course. And for our facility, and for the mission we have, I have a poem that I want to recite.
Please do.
Yes, Jacob. Oh, United Nations General Assembly 2015 came up with Sustainable Development Goals to be achieved 2030. Oh, Sustainable Development Goals. Sustainable Development Goals. The Sustainable Development Goals are a collection of 17 interlinked global goals designed to be a blueprint to achieve a better and more sustainable future for all. The Sustainable Development Goals were set up in 2015 by United Nations General Assembly, are intended to be achieved by 2030. The Sustainable Development Goals are a universal call to action to address the 17 goals. Oh, builders of Africa's future. Oh, Association of Consecrated Women in Eastern Central Africa, AQUECA. Oh, builder of Africa's future, Sister Jane Frances Kabagaaju in this 2022 cohort. What? Yes. By 2030, reduce the global maternal mortality rate to less than 70 per 1,000 live births. What? By 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25% per 1,000 live births. Maternal and child morbidity and mortality. Oh, builder of Africa's future, Sister Jane Frances Kabagaaju in this 2022 cohort. That I have passion to contribute towards goal 3 of the Sustainable Development Goals, that is, ensure healthy lives and promote well-being for all at all ages, particularly maternal and child health for God and my country. Here ends my poem.
That's very beautiful. Thank you so much. That was quite inspiring and just beautiful. Thank you so much. Well explained. Just for us to now we have a sense of what you're building, which is just incredible. And I just love how you ended with the poem. And you will inspire other builders of Africa future, your cohort members as well. So it's a very good summary of just what you're building and how you envision it by 2030 and beyond. So thank you so much. Thank you.
You're welcome.
So now for the third phase of the interview, we just want to ask you some questions about as an entrepreneur, which you are, and you have built something that is really transforming the lives of people in the community, HIV tests, diagnosis, counseling and all that, and working with mothers, avoiding HIV transmission from mother to child, and all these amazing things. What is some of the advice that you give to other sisters or to young people who are trying to build stuff, build companies, or build something that can have an impact in the community? Do you have any advice that you love to share?
So, when you if you want to start like an entrepreneur, you first look at the needs of the community. Look at the needs of the community, not the wants. Then you don't think for the community, because if you think for the community, it might not really be the problem that they are having. Mm-hmm. And you'll be disappointed when you put like an entrepreneurship, you put like an entrepreneur in an enterprise in place, and people don't utilize it.
Exactly.
Yes.
Exactly. That's a very good point. Needs versus wants. Focus on the needs, not the wants.
Yes, please.
I'll also write that down. That's important for me too. Do you have any things that help inspire you to learn more about entrepreneurship? I know, do you have a book, or do you have something that helps you just to become a better entrepreneur? I know the Builders of Africa's Future is a good cohort. You get to learn from your colleagues and from the experts.
Yeah.
Do you have any recommendations for any material of someone that people could watch to help inspire them on how to become an entrepreneur?
Yeah, we had wonderful people who took us into AMI, the Kelvin and his colleague. So there is a book of business model canvas. That's all that you need to come up with a project. Because you have all what you need to start an enterprise. And in that very institute, we learn how to make and manage money, to have innovation mind, and how we can interact with people, communication, how we can communicate with our clients. So business model canvas, it's a very good book or a course that someone would take.
I agree. I don't know if you just said this intentional or not, but saying that you have everything it's already everything you already have everything you
yes,
to build a company. I like that.
Yeah.
What's any advice that you have received that that has really helped you along the way? I know your family has played an instrumental role, your sisters have played an instrumental role. Is there any advice that sticks out to you that says, this helped me think more clearly, or this helped me understand that,
to understand who I am?
Yes.
Yes. So my father, that thing which he really did to me when I was young, to be given a responsibility to take care of my elder brother, even my young brother, really gave me a stronger a spirit within me that I really can be a leader. I can lead others, I can help others. Then I started asking myself, what is it that my father has seen in me that forced him to give me this responsibility, not my elder brother? So that built me the mind and to do the work. That all the work that I've been doing, I have that trust that in me that I can do it, because it was installed in me by my father.
Exactly.
Yeah, even the responsibilities that the congregation are giving me.
Yeah.
All my life I've been in leadership. Leadership. And finally, when in this course, I'm proud to say that I was selected among the three to take this course of Builders for Africa's Future. So it was not a surprise to me, because I know it was installed in me. And I thank God for that. It's a gift from God.
It's a gift from God.
Yes.
It's a gift from God. That's inspiring. That's inspiring. And thanks for being a leader. It's not easy. It comes to a lot of challenges too. I think there's a question that I think I missed out. What were some of the early challenges that you had, or what are some of the current challenges that you have now within this center, and how are you navigating that, and how are you trying to address some of those one or two challenges?
Yeah, the government of Uganda, my country, together with donors, have implemented several interventions in addressing problems facing maternal and child health services. These interventions were to address the three delays: delay to decide to seek appropriate medical care, delay to reach the appropriate health facility, delay to receive adequate care when a facility is reached. This implementing pattern in Uganda provided transport vouchers for mothers to go for antenatal, delivery, and postnatal. This project worked very well. Every pregnant woman accessed obstetric care in time because of transport. Even ambulances could come and pick mothers for cesarean section. There was a remarkable reduction in maternal and child morbidity and mortality. Now, immediately when the the project ended, the number of mothers for antenatal delivery and postnatal and immunization, the number going to the facility and Nkuruba Health Centre inclusive, reduced drastically. The project could not be sustained by the government nor by the community. So with the team, we said, we came up with an idea of bringing these obstetric services nearer to the rural community, that they may no longer need to travel long distances to access quality obstetric care. And this could really be done by constructing permanent infrastructures, theater, maternal child clinic, sonographer, department, doctor and staff houses in this rural community. So that those challenges, mother not finding services, mother not finding personnel, mothers not having transport to transport them, those problems could be solved. So for us, we feel like we want to avail the community with obstetric services in these sub-counties, which we really want to make a pilot, using a modern ultrasound scan and a well-equipped theater, which will be affordable. And of course, the facility will be accessible. And we want to have high quality of competent personnel nearer to this community who would be there 24/7 days. And we shall stand out to reassure mothers for a safe, normal delivery and a confirmed cesarean section. And in these 5 years, the plan that we have for the 5 years for Nkuruba, Nkuruba, it is registered under Ministry of Health. It has annual practicing license, which is renewable. Once the facility gets infrastructure and personnel, it can be upgraded to a health center then later to a hospital level in this rural area in the next 5 years. We already have maternity ward and antenatal room. We have already located suppliers for a modern ultrasound scan, theater equipment, and the construction materials and the personnel. We are praying for investors and donors to support us in implementing this project. Just we want people to join us so that we can achieve this sustainable goal 3, which were set up by the United Nations General Assembly to 2015.
Yes. No, that's great. That's great. And everyone who's listening to this episode, Build Up of Africa's Future is, part of the African Diaspora Network, but any way you can, be a part of it, not only just sharing the story, sharing this episode can really help, highlight how important this is and the work you're doing, Sister Jane. So I appreciate the work, and I'm sure some of the listeners will really appreciate your work as well, and what you're trying to build in Uganda and the impact that it's going to have on society. So thank you so much for your work. For the last question, and I asked everyone this, just put things in perspective. How do you see, how do you see a legacy to be? And what I mean by that is, what do you want people think about your work, even when you're, as you continue to build your health facilities, but just how you also want to make a difference in the health of people in Uganda. What do you want people to think about as you continue to build this amazing health facility?
Wow. For sure, okay. Humility.
Yes.
With humility, for sure, as God has given me this opportunity, I want really to be remembered in Nkuruba, to have brought quality services to this less privileged community, to have everything that a common man can have in this rural area, in line with health, especially with maternal and child health. To have an outstanding, a modern ultrasound scan, a well-equipped theater in the rural community that was set by Sister Jane Frances, and people are utilizing these services, I will be happy. I will be happy to be remembered of that.
Yes.
And people will really pray for me even after my death, that services were brought nearer to them. Those who used to walk long distances, those who used to congest referral hospitals, sleeping on floor, they are accessing services nearer. And they will say, there was a sister called Sister Jane Frances, and who were trained by Africa, by builders of African future, and was able to be helped by the nation to do that. I'll be happy, and even when I go to heaven, if God gives me a chance to look at Nkuruba and see people utilizing these services, I'll be the happiest saint.
Amen. 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 No, that's a great. That's just a great way to look at it. And thanks so much for sharing. I think it's happening. You're already making the difference, and and I think you will continue to make a very big impact. And I think God loves your work. So thank you so much. Thanks for everything you're doing. Thanks for thanks for coming on the pod. Thanks for being part of Builders of Africa's Future at the African Diaspora Network. And I will I'll be here to support you. And we're always here to make sure that your work gets the notice, and it gets highlighted on the international stage. So you should get support that will make your work easier. So thank you so much, Jane.
Thank you very much, Jacob. Thank you.
Sure. Thank you. Yeah, so that's Sister Jane Frances. I want to make sure I pronounce your last name well. Kabagaaju. Kabagaaju. Thank you so much, and have a wonderful day. And to all listeners, thank you so much for being here.
Thank you.
Take care.
Bye, Jacob.
Bye.